just wanted to get on here and share a few things that have been going on here at the office and with me personally. This is Dr. Jacob Unger, our medical director, and he recently did a neck lift on me personally, and it was one of those things that I hate that I waited so long to do it. I think so much we kind of think, oh, we'll wait till you're older and then I'll need to lift that skin. But I'm really a firm believer in as you age, you tweak as you age. Just small splashes of Botox. Keep the lines soft. Work on preventative things, good skin care. But eventually, it's not if, it's when you need to go under the knife. And for me, I had some sagging and I just needed just a little bit of tightening through here. Not really a full face lift, but a full neck lift. And so he did such a great job with it, which I am thrilled with the results. And I'm only probably 8 weeks out and have a little swelling, but it wasn't a big deal. And truly, it was one of those things that I kept thinking, why have I waited this long to do this? And so I'm going to let him kind of share the technical part of what you did and do your magic.
Well, Karee, thank you. So the reason why you waited was because you're a beautiful young woman and you didn't need it until, probably fairly recently. So I absolutely agree with you. I think one of the keys to aging gracefully, which is really the goal here, is taking part in continual maintenance. Just like we maintain our homes, we maintain our vehicles. What you offer is the highest level, the most cutting edge skincare and rejuvenation that's out there.
Right.
And through the processes that you provide and the services you provide, you're able to help men and women look and feel their best on a daily basis. And that's very helpful, and that helps us feel fresh and look great. But father time, as they say, doesn't stop for anybody. Okay, and
help.
So while your skin is always wonderful and you're blessed with wonderful genetics and you're a beautiful woman, you notice in yourself that
wait till you see my befores.
The jowling, the neck becomes to come down, and that's one of the first signs of aging. So like when we talk about facial aging, it's loss of volume and descent of tissue. And you are in those early to mid stages of getting that descent of tissue. The bands in the neck were starting to show, the fullness in the lower face. Instead of having that, what we call the OG of youth, that kind of inverted egg shape, you were starting to get a little full and heavy down here. And so you thought, what can we do? And we went ahead and did what we can do. So what we did was a neck lift or a lower face lift, which is rejuvenating kind of the jawline all in through the kind of jawline area and in through the lower neck. And we also added fat, which is part of that volume that we lose. So in the perioral region, kind of in through here and in through here, where you get sunken and hollow, we added volume back that we've lost.
That's a good point, because a lot of times as they age, we lose collagen. And for me, going through menopause, like you kind of deflate. Your collagen breaks down, and I feel like everything was kind of falling. And here, it was just all setting right here. And so this is me before.
So here's our side view beforehand.
Yes. Yeah. There's her.
And so we had all this lack of distinction along the jawline. We lost the angle of the mandible, the angle of the jawline of the contouring. There was fullness in muscle bands. You had your cheek started to come down. That led into, very mild. You're still a very attractive young woman.
Needed some love.
But we just kind of lost that clean, crisp contour. Okay? And we don't want to look overdone ever. Okay? I never want to be accused of saying she's had work done. And you just look like you. But now your jawline is clean. Your neckline, you can see the musculature of the neck. You can see all your beautiful contours. And really everything that we'd want to see is just healing and beautifully and naturally.
And the thing is, you can't, I don't know how you did it, but you can't see any scars. So the way you pulled this back was kind of behind the ear a little bit.
Yeah, there's a lot of technical aspects, of course, but really the key to making this look natural is working on the deep structures of the face and the neck. There's musculature on the neck. There's something called the SMAS, which is a muscular layer in the face. We enact our change on those deep layers, putting them back into their old position. And then the skin gently redrapes in the natural tension that it was always supposed to be under.
That makes sense.
But now that the deep face is in the right spot, there's a little extra skin. So we remove the extra skin. We make sure everything is locked into position where it should be, so it doesn't drag or pull. And then you get to have that nice, elegant, natural contour. right? That's the key, and that's the problem with facial aesthetic surgery, because unfortunately, what you see walking around the street when you say, "Oh God, look at that facelift, that's terrible," the problem is with this type of surgery, you only notice the bad work. No one would really know that you had anything done unless you told people, which is, you're an open book, and that's one of the things that your clients love about you, that you not just give treatments, you also receive treatments, and that's the key to good facial aesthetic surgery. It should be a big change, but no one should be able to tell.
Right. I do. I think that's the key right there. Even with your Botox, just you want to look fresh and rested, not overdone. It's almost better to do less and then add more with that kind of stuff. But it was definitely time for me to do this. So I was thrilled to do it. And I have to say, it was, the downtime was, I wore a wrap for a couple of days. I had a few stitches that were taken out.
Yep,
probably
7 days. Between days 5 and 7, a little wrap for a day or two.
No drains, swelling, bruising a little through here. So when you said you did fat, you injected fat. Where'd you do there?
So we took a little bit of fat, remember, from your belly. We took that fat, we injected it with little needle poke holes, no additional cuts, and we can use that. It's very similar to filler that I believe in, and I think is a great adjunctive treatment to aging to help prevent those deep lines and help to fill areas that have had some deflation. But when you're having surgery, the beautiful thing is we can take your own natural body tissue and inject that in a very reliable way to fill the deeper compartments that have been deflated, as well as soften lines in those deep portions. Great thing about fat is you can get as much of it as you need. Not that you need a ton of it, of course, but it's a lot more than filler, which comes in 1 cc aliquot. So we probably injected, I don't have my op report in front of me, around 15 to 20 cc's of fat into your face in this region to fill those areas back in a really natural way. That's permanent filler because it's your tissue. And it acts just as the rest of your tissue acts because it's just replacing that lost volume.
Does it stimulate your own collagen when you in that area, or is it just using the fat to create the volume? It's not.
So I don't like to oversell anything. There is absolutely a special hormonal mix and stem cells within fat. We know that. The long-term implications of that, just going by the science, we know stem cells can help rejuvenate and restore things. We know that the hormonal mix within that fat can help to stimulate collagen growth and create improvements in skin texture overlying where fat's injected. That much is clear. But I think there's so much benefit from the volume in and of itself that there's no reason to try to tout magical extra abilities. We know that this is a long-term permanent solution that adds that volume back that you otherwise can never get back.
Something else that I've been doing, we recently purchased a new laser, or a new treatment, and it's the Opus laser, and it works, it's a plasma laser that creates, it's almost like reverse, what am I trying to say, ablation underneath. And so it grounds it when it touches the skin. It's a roller, and so it's almost ablating underneath the skin. And the old CO2, it's similar to a CO2 fractionated laser, but without the downtime. And so it's bypassing that top layer of the skin and doing more of the thermal heat injury, the controlled injury that we want underneath to stimulate the collagen. So I have been doing those, and those are great. I mean, I had one done Wednesday. And so what I love is that I don't have the downtime of the oozing and the peeling and stuff. And so doing a series of those, I think has made a huge difference. And I've been working on my neck and my chest. And you've had one.
And so that's a really good point, Karee, because facial rejuvenation is all the way through, right? So what we did together, I like to think of as foundational work, rebuilding the foundation, rebuilding the house. But that doesn't replace the need for siding, windows, and paint, right? So you need to continually work on your skin. Obviously, this laser is a great opportunity to really get very deep into the skin to rejuvenate and refresh and get neo-collagen formation. And then, of course, there's a level even above that, the even more superficial level that you do with facials, skin treatments, appropriate skin care, sunscreen, etc. So you really need every part of the puzzle. And obviously, the deeper you go, the less frequently you need it. You don't need to rebuild your house every week or year or even 3 years.
I just put a new roof on. It's gonna last me a while.
Yeah, you got you got a decade there minimum. Okay, so So it is about that stepwise approach, and that's why it's great to make sure you're combining top-down care.
Right. I always say, you can only be as good as your skin. You got to work on your skin.
Absolutely.
And then a little tweaking here and there. But I just wanted to share with you all what I've been up to and introduce you all to Dr. Unger, who is amazing. I encourage you all to look him up, look at his background. He did some really neat things in his training and for years, very advanced, that is very impressive. So thank you so much for tuning in.
Thanks. Bye-bye.